they come and they're in the room. So the minute that baby's born, they're highly trained for those emergencies.
It's the only one in Iowa, actually.
Yeah.
So even University of Iowa doesn't have a neonatal transport team, which is amazing. They don't, but
and they take that baby and they're in charge and they take over, and that's a really big service. And what's interesting about it is it's not required by state. It's not required by county. It's not required by city. It's just something that the hospital has committed to do, and that transport team travels throughout the state. I think last year, and I'd have to go back and look at the numbers, but I think they were in like 58 counties. Right now, if, say, mom has a problem here, baby has a problem, they didn't know about it, it just happened, 2 separate ambulances have to go downtown. Mom has to go in one, baby has to go in another. Dad has to decide, okay, which ambulance do I go in? Do I drive? And then grandma and grandpa and friends. So what this ambulance will do, mom and baby can travel in the same ambulance. It's got an extended cab with extra seats, so dad and all the family can ride, so it's safer for them. They can be close. But also, and this is, again, more rural than it will be here, but if a specialist is needed, they can travel with the ambulance and begin treatment there. And the ambulance itself is a self-contained hospital for room. They wanted to make it very easy for patients and families to move around the hospital. Beautiful way to move around the hospital. The patient with the room service really gives patients the opportunity to choose what foods they want, when they want it. It really improves patient satisfaction, and then the food options are, the real focus is on fresh, making it healthy, and giving folks options, and so they'll have all of those options. The cafeteria, which is on the lowest level, is both for the hospital and for the community. And in fact, there's a lot of the areas on the lowest level that are for the community as well as for the hospital. The cafeteria will be used for families to dine in, but as well as a gathering place for community members. There are also 2 education conference rooms that will be used for community health education and training and health awareness. They'll drop down screens and projectors. The room can be divided in half. And again, patient education and awareness is so important. With diabetes, it's one of those key ones. That's one of those that we could easily do out here. There could be some prenatal classes out here. Natural settings are really important for the recovery and healing process. In addition to having indoor dining, there's also an outdoor patio dining for patients and families. As well, there's a healing garden that has been incorporated into the ground, and that is a place, it's going to be quiet, beautiful flowers, a small water fountain that folks can just go and enjoy nature. And again, it's really important, and it helps with that healing process.
We're excited to be part of Dallas County and serving the Dallas County community as a hospital here. And we look forward to seeing everybody on October 18th for our community open house from 2 to 4 here at Methodist West.